Hi everyone. Today in this video we are going to discuss about meloxicam. Meloxicam is one of the drugs which is classified as NSAID, non-steroidal anti-inflammatory agent, and among this category this drug belongs to oxicam category. We can clearly observe this chemical category within the suffix of the name. We can also find few of the other drugs with similar suffix such as piroxicam, tenoxicam. All these are oxicam derivatives. And being an oxicam derivative, this drug mainly shows anti-inflammatory actions. Particularly, this drug can reduce ESR, erythrocyte sedimentation rate, as well as levels of CRP, one of the inflammatory protein. So when their levels are reduced, the inflammatory cascade can be reduced. That's why this drug is useful as anti-inflammatory agent, particularly in the treatment of arthritis. Second important thing is that among the NSAIDs which are non-selectively inhibiting the COX enzymes, this drug is somewhat selective in the inhibition. This drug shows more selectivity towards COX-2 enzyme compared with the COX-1 enzyme. Due to the selective inhibition of COX-2 enzyme, this drug shows somewhat less side effects that are related with inhibition of COX-1 enzyme. This drug shows somewhat less side effects such as gastrointestinal and renal side effects, which are mainly produced by inhibition of COX-1 enzyme. Particularly, this selectivity is observed at low dose of meloxicam. But when this drug is used at high doses, this selectivity is going to be lost and it can inhibit both COX-2 as well as COX-1 enzyme. Now, meloxicam can be used in the treatment of rheumatoid arthritis, where the inflammatory response can be reduced by meloxicam. Similarly, it can also be used in the treatment of osteoarthritis. Rheumatoid arthritis is mainly produced by autoimmune disorder. Here, meloxicam is not interfering with the immune response, but whatever the inflammatory response produced by this autoimmune activity is going to be minimized by this meloxicam. Similarly, osteoarthritis is a degenerative joint disorder. Again, in such conditions, meloxicam can produce anti-inflammatory effects. This drug is also useful in the treatment of juvenile rheumatoid arthritis. What are the rheumatoid arthritis observed in the children? In such conditions, meloxicam can be used in the children with age greater than or equal to 2 years. So today we will discuss how this meloxicam acts, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, what is the chemical nature of this drug? So this is the structure of meloxicam. And here we can observe the heterocyclic ring system with sulfur and nitrogen. We can start the numbering from sulfur. So this is 1, 2, 3, 4 and so on. Now here sulfur and nitrogen are present at first and second position. So we can write this suffix as 1,2-benzothioene. But at the third position we can observe a carboxamide moiety. So we can represent this with a suffix 3-carboxamide. So now meloxicam is a 1,2-benzothioene 3-carboxamide derivative, and it is having the other side chains: fourth position hydroxy, second position methyl, first position dioxo. Then at the third position on the nitrogen, it is having another heterocyclic ring system, which is nothing but 1,3-thiazole. So we can write this as N-1,3-thiazole 2-yle. And this thiazole ring is having a methyl group at the fifth position, so 5-methyl. That is the complete name of meloxicam. Now let us see how this drug acts. Just we have discussed that meloxicam can inhibit the activity of COX-1 enzyme as well as it can inhibit the COX-2 enzyme. COX-1 enzyme is called as constitutive enzyme, which is always present, whereas COX-2 enzyme is inducible, which is expressed only in the conditions of inflammatory response. Now, COX-1 enzyme is present in the stomach, where it is responsible for decreasing the gastric acid secretion, and it is also present in the renal system, where it is going to increase the glomerular filtration rate. So COX-1 is having some of the beneficial actions at the stomach as well as renal system, whereas COX-2 is inducible, where it is responsible for increase the fever, increase the pain as well as increase the inflammation. Now meloxicam can inhibit both COX-1 as well as COX-2 enzyme activity, but it is somewhat more selective towards the COX-2 enzyme compared with the COX-1 enzyme at low doses. So at low dose, meloxicam will have less side effects that are related with inhibition of COX-1 enzyme. Now, phospholipase A2 is one of the important cleavage enzyme which is going to be more expressed during the inflammatory response. This phospholipase A2 can act on the phospholipids, where it can digest these phospholipids to release one of the important mediator, arachidonic acid. This arachidonic acid is a C20 fatty acid which can be converted into various types of mediators. But one of the pathways is the COX pathway, which produces the prostanoids. Now this arachidonic acid can interact with the COX enzyme, where it is going to be converted into cyclic endoperoxides such as PGG2 and PGH2. Now again, these cyclic endoperoxides can interact with the COX enzyme, which is having the peroxidase activity, such that they are going to be converted into prostaglandins such as PGE2, PGI2 and thromboxane A2. All these are responsible for setting of inflammation, induction of fever, precipitation of the pain at the site of inflammation. Now meloxicam is one of the drug which is going to block this COX enzyme activity, thereby it can reduce the sense of prostaglandins so that it can control pain, fever and inflammation within the body. That's why meloxicam can be used in the treatment of rheumatoid arthritis as well as osteoarthritis. Now let us see the precautions of meloxicam. This drug meloxicam can increase the risk of cardiovascular disorders. So in the patients with pre-existing cardiovascular disease, this meloxicam should be carefully given. Particularly the risk is increased with thrombotic events produced by this meloxicam. One of the important prostaglandin, PGI2, is responsible for vasodilatation. Now it can act on the IP receptors which are expressed on the vascular smooth muscle. When this prostaglandin I2 binds to the IP receptors, it produces vasodilatation. But in presence of meloxicam, this PGI2 biosynthesis is going to be inhibited such that the PGI2 levels are reduced, which results in vasoconstriction. Now because of vasoconstriction, the platelets come nearer and they can be more aggregated. So meloxicam can increase the risk of platelet aggregation, which further increase the risk of stroke as well as myocardial infarction in the patients. So the patients with cardiovascular disorders, this meloxicam should be carefully given. Similarly, this drug can increase the liver enzymes, particularly ALT, alanine transaminase and AST, aspartate transaminase levels can be increased up to 3 times. And rarely this drug can produce some jaundice and any fulminating hepatitis in the patients. So these side effects are rarely observed with this meloxicam. Similarly, this drug can increase the inflammation of stomach as well as intestine. Again, this is because of reduced production due to inhibition of COX-1 enzyme activity. So this results in the ulceration of stomach as well as intestine and increased perforation. Finally, it can also lead to some gastrointestinal bleeding. So all these side effects are observed with meloxicam, particularly at high dose when it is prescribed for chronic periods. Normally at the intestine, gastric acid is going to be released from the gastric parietal cells, which is controlled by prostaglandins. So arachidonic acid can be converted into prostaglandins such as PGI2 and PGE2, which are having some protective action, and this conversion is mediated by the enzyme COX-1. Now these prostaglandins can act on the prostanoid receptors so that they can inhibit the release of gastric acid. But in presence of meloxicam, particularly at high dose, it can inhibit the COX-1 enzyme activity so that it can inhibit the synthesis of protective prostaglandins. And when these are not synthesized, the gastric acid secretion is not controlled so that more gastric acid is released, which results in the increased ulceration, perforation or even gastrointestinal bleeding within the patients. So any symptoms of severe abdominal pain, anemia and any other symptoms of gastric ulceration are observed, then this drug should be carefully used. Similar to the renal system, again this COX pathway is important, where COX-1 enzyme is involved in the sense of PGI2 and PGE2. Now these prostaglandins can act on the renal system, which is again expressed with the prostanoid receptors. So when these prostaglandins bind to these prostanoid receptors, they can increase the efferent vasodilatation, resulting in the increased glomerular filtration. So they can increase the filtration rate by the renal system. But when this meloxicam is used, it can inhibit this COX-1 enzyme activity so that it can reduce glomerular filtration rate. So when this filtration rate is reduced, it can reduce the renal functionality. Finally, it can lead to the renal failure, which may result in the liver dysfunction and fluid retention. So care should be taken when this meloxicam is used at a high dose in the patients with any renal dysfunction. Similarly, meloxicam can also increase the blood pressure, resulting in the hypertension, and it can also increase the bronchospasm in the patients, which is particularly more important in the patients with asthma. And it can also precipitate few of the skin reactions such as pruritus, or even it can produce Stevens-Johnson syndrome due to any hypersensitive reaction. What are the side effects? The important side effects of meloxicam mainly include abdominal pain, dyspepsia, diarrhea, flatulence, and even it can produce central side effects such as dizziness, headache, pharyngitis, and some edema, anemia, and any skin rashes can be observed with this meloxicam. How it is given? This drug is available as tablet as well as oral suspension. It is also available as IV injection. The initial dose of the drug is started at low dose, particularly it is given as 7.5 mg given once daily. But the dose can be increased up to 15 mg based on the conditions of the patients. In the children, this drug is given based on the body weight. So it can be started at 0.125 mg per kg. And the recommended dose is again 7.5 mg given once daily. So that's about this drug. Meloxicam, which is a oxicam derivative and is a non-steroidal anti-inflammatory agent. Since this drug produces anti-inflammatory actions, it can be used in the treatment of osteoarthritis as well as rheumatoid arthritis. And it can also be used in the juvenile rheumatoid arthritis in the children with age greater than 2 years. So this drug may increase the cardiovascular disorders such as stroke and myocardial infarction because of any thrombotic events. And it can also increase the gastrointestinal side effects resulting in ulceration, perforation and bleeding. And these side effects are particularly observed at high dose of meloxicam. At a low dose, this drug is somewhat more selective towards the COX-2 enzyme. Therefore, it shows less gastrointestinal and cardiovascular side effects. That's why this drug is initiated at a low dose of 7.5 mg and the dose can be increased up to 15 mg. So that's about this drug, meloxicam. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.